Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey Wells, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Hello, everybody, and welcome to this week's Knowledge Nugget of the Executive Innovation Show. We're going to be talking about what is telemental health, use cases during COVID, and really breaking down how to reduce no-show rates during COVID, keep folks safe during COVID, and how to really help with isolation during this difficult time. So let's really break down what is telemental health and why it's not video conferencing. But first, I want to talk about some statistics. As we look at no-show rates in mental health, it's anywhere from 23 to 34%. Some folks, especially in smaller practices in rural areas, are seeing no-show rates up to 50%. COVID has helped as we live in this more virtual community now with video being part of our everyday life. But how does that extend post-COVID, and how do you use it during this time? First of all, telemental health and a telemental health platform is very different than your standard video conferencing or a FaceTime, Skype, Google Duo, things like that. And so let's talk about really why. So for telemental health, the virtual communication that's now a part of our everyday life, video conferencing tools will definitely help if you're a solo practitioner or a solo therapist. But as we look at 10 practices and higher, what are some benefits of a telemental health platform and why you should be looking at it? Number one, it really allows for best practices for operational efficiencies. As administrators, as executives, you're able to see across all of your therapists the number of appointments that they're doing, the duration, the patient satisfaction at the end of that patient engagement, to really gauge how your practice is doing during this time, to really gauge who is canceling appointments. Could you be doing things a little bit differently? One thing that therapists are doing right now during COVID is, instead of your typical 1 hour appointment of coming into the office, is really breaking that down just to keep people's attention and to have more frequent engagement, is doing 30-minute appointments. So it's much easier from a no-show rate for somebody to carve out 30 minutes of their day to do a video telemental appointment than an hour. So if you're only doing hour appointments, try looking at doing 30-minute check-ins and see if that can move the needle on those no-show rates. That's one thing. In addition, as we look at the senior community that's isolated in nursing homes, the mental health rate has dramatically gone up. Video conferencing historically has not worked for those demographics because of the complexity of creating accounts and knowing their iTunes passwords to download applications and things of that nature. So looking at something that's simple with an ease of use like a telemental platform that is just a couple clicks, browser-based, and the ability to be able to add caregivers to those interactions. So if my mother or father is in a nursing home, I might want to attend, not every meeting, but I might want to attend those meetings if they have dementia or they have another underlying condition, to kind of explain some of the things that I've been seeing over the last week or two. So being able to add those caregivers simplistically. So, you might be able to send them a text link or do something other than just opening up a meeting room. When we look at the security around video conferencing, you don't want to be using URLs that are the same for every single one of your patients, because you and I could be having our telemental appointment right now, and my next patient could come 5-6 minutes early, and all of a sudden I'm in this very uncomfortable position as a mental health provider that my next patient's now in the room listening to our conversation. It completely throws it off and shuts the patient down from a compliance perspective for them to open up. So make sure that you're really securing those rooms, you're using the proper HIPAA compliance and video security for the token of connection, that it is only for that room and not open up to additional parties to join. The next is really our youth. You have a lot of folks that are not going to school right now. They're doing virtual school. Maybe they're doing a hybrid model, and they're used to being able to talk to that guidance counselor, that teacher, whatever that may be. And that's not happening. So being able to virtually have more check-ins with youth, to be able to add in case managers, to be added birth parents, foster parents, things like that, and get those parties involved and breaking up and being able to have parties that dip off. Maybe they're only on for 10 minutes and then you talk to the child or the parents come on at the end. And having that flexibility of workflow, that really helps out with the follow-up and the workflow required. The last thing that I really want to cover of the differences of video conferencing and the telemental health is the ability to really have the analytics behind the technology, to be able to, with video conferencing, you're looking at solo accounts, and if you wanted to go look at 10 therapists, you'd have to go one by one by one. Having that overarching across different physical locations or virtual workforces, folks working from home, and having that insight to what's going on, having those, even a therapist survey at the end to know if there needs to be more frequent visits or if they're okay for a couple of weeks. That really helps from that standpoint. So if we go back and we look at no-show rates, if we look at the average 10 provider practice, the loss of revenue and no-shows per year is over $850,000 to that practice. So if it's not a priority to you, it should be a priority to you of how to decrease those no-show rates, and that looks like a hybrid model. Telemental health really helps with reducing those no-show rates while keeping your therapist and your patients safe. So as we look at that and we look at the other side of it of how do you acquire new patients, one of the big things going on right now with COVID is it's very hard to acquire new patients because people aren't coming in. Make sure you have a virtual intake process for new patients to be able to provide their insurance, to be able to fill out any new paperwork online. Make sure that you really reduce that appointment time for that first appointment. The average is like 13 days. That will really help from that standpoint of being able to do that. Even if it's a 15-minute call for a new patient to have that initial session to understand what they're looking to get out of therapy, that's really helpful. And then from a marketing standpoint, telemental health really allows you to broaden that geography reach. So there's plenty of mental health shortages in the area. There's plenty of outpatient settings that it's very hard to get a psych appointment. It's very hard to get just a therapy appointment. So look at your geographical reach in your radius that you've typically been marking and think about, if I extend that, what opportunities does that open up for me? And then how do I look at my schedule? If you're still doing physical appointments and people are coming in, how do you manage that schedule and say, I'm going to do telehealth in the morning and I'm going to do physical appointments in the afternoon, or vice versa on certain days, to really get the most efficiency? Most mental health providers can see sometimes 2 and 3 times more patients per day on doing shorter telehealth versus in-person, of the logistics of waiting room and walking people in and out and things of that nature. And then the last thing is a good telehealth platform will allow you to do on-demand crisis. A lot of therapists don't provide this today, and it allows a great opportunity for increase in revenue and better outcomes with your patients. So if you're supporting skilled nursing facilities, nursing homes, if you're supporting school districts, being able to have a telemental health digital lobby right on your website, that if it's 10 o'clock at night and you had crisis, that you would be able to talk to somebody your patients would be able to click a button and it would text any therapist or professional that could handle that. If you're set up for that type of environment, or you want to be in that type of environment, proper on-demand crisis telemental health can be really beneficial. So that's today's Knowledge Nugget. As always, if you have any questions, if you have any topics that you'd like us to address, please submit those to us. We'd love to develop those into a future show for you. Please, as always, subscribe so you get your weekly podcast delivered right to your podcast player of choice. Thank you for this edition of the Executive Innovation Show, and stay safe.
This podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.